was Asem na Krestika. TikTokers abe blasted Mahama Ayariga our majority that in parliament. Only Kabinamita account our health minister concerning their take on the zip line. Say the drone el supply moja near that. Obi just say yen twem. Na eno ana TikTokers abe blasted, Kabinamita account any majority that in parliament. Ma ntiri mu na chede wadwen amame. Ewo comment section. Ha Penyah block media. Mesro say any demo. Obe like video no that my blog subscribe button snap click notification icon for latest updates na ba chere wa adwen da mama e wo comments e nso ba so a no share for so enya bi ahye oba Ghana han there's one particular project and as a policy NPP government with the help of Baumia as and a boy health sector honor pa in fact a boy honor got omo nkurase no omo na nya so mfaso because o kuromu dia oba dwene say enyansem bia anim but omo nkurase no any who the benefit of that zip line drone delivery network using drones to supply medicine, blood infusions and other things. Everyone class for ne pa because be a hospital kesi ni no. Ni papa pani afre na omo aye delivery na say aba na de ompesum de na moja no be hia ye de amano. Everyone class for no but omo mo krom omo hu faso bi e wo so. No, there has been a whole lot of conversation that circles around this zip line. Am I even catch it crano? Zip line honum no closing it down. Say we also closing down say zip line no Ghana hanum no omo che say yen twam just yen closing the kra. Na eno ana majority that in parliament Mahama Ayariga General Parliament has no tell mu say zip line about Ghana ka almost 170 million every year. It in Ghana yen cancel yen twam.
Zip line. As for zip line, even in my debate yesterday, I indicated clearly that I am against the zip line contract. I'm against the zipline contract. You cannot spend 170 million Ghana cedis that you are sending blood to health facilities using drones. You can't continue spending that kind of money that you are paying a service provider. It's a total waste of money.
Yen twamne so a wa quote figures 170 million a year eson Ghana but yen sika 300 million eto part e man kwara. You apply common sense. You use common sense kakra. Something that can save life. Using drone to supply blood. Blood can save life. Part doesn't save any life. Massa. Part ain't save life. And no, you say idea save life. The life-saving policy no. You say yen twem. A cost to a minor 170 million cedis a year. Yen twem. Yen came to a yen twem. Part that doesn't save life. Part. A cost to a man 300 million cedis. 300 million. And no dear or man being sikato. Yes, and no ye. But zip line, yen twem. Let common sense do this simple calculation. Apply common sense. Yes, yen twem. The life-saving policy yen twem. But a day and for so be any so more and shed that ma or mine no. Nyansen be any mono or mine being sky. And they say no to us. Emma and what you know. Health Minister just say why many interviews, why many press conferences try to explain how bad the zip line was. I was like, hey, and this government muyi. Edeba dear pa na motor Ghana, but some Ghana for say, dear BMP the buy and papa. I China when I'm certain as Is that what much say? Dear Pia MPP about here na Korean and papa. And Minta kind of children zipline crown they supply textbooks any other.
Let me use the opportunity to clarify the happenings in the zipline, the drone services. A contract was signed in 2018. It took effect in 2019. And as part of the contract, there were clauses known as take or pay clauses in the agreement. And the contract was so sourced. Now, for every month, Ghana government was and is supposed to pay $88,000 per center per month. $88,000 per center per month. So if you do the computation, we are paying more than, because we have 6 centers, so we are paying a little over $500,000 every month for the services of the drones. What is more interesting, I think everybody needs to know, is the fact that in the beginning of this contract, the idea was that we were not going to use government of Ghana money to pay the services of the drones. And I have the Hansards here doing the debate on the floor of the House, and the quotation from the then minister responsible for health, Ajimamanu, I have it here. I think that the question was asked about why the signature of the minister responsible for finance then was missing in the contract, and he had this to say among other things. Mr. Speaker, I would want to stress again that the Honorable Minister for Finance did not put his signature on, because this is not going to be done from the consolidated account. The public purse is not going to come in here, unquote. And the whole discussion has to do with the fact that they were not going to pay from the government of Ghana fund. And some other stakeholders were engaged, and I've had the opportunity to verify from them, including the GMA then. And same argument was advanced. Apart from saying this on the floor of the House, government of Ghana has paid a lot of money to the zip line. Apart from that, their services was to concentrate on the hard-to-reach areas and emergency services. But upon review of the activities, what we have realized is that the hard-to-reach areas constitute only 12% of the activities, 12%, 1-2. And emergency services is 4% of the activities. And it will interest you to know some of the items they fly. Items like condom, blood donor cards, not blood donor cards, mosquito nets, food and nutrition items, adhesive tapes, syringes and needles, education materials, among other things, textbooks, exercise books, uniforms, and a lot more. So these are some of the items they have been flying. And so when we came to office, we think that there must be value for money. And therefore, we are engaging them. So if you hear that we are not engaging zipline, it's not true. We have met more than 3 times, and we are still engaging them to know how we can have value for money.
In school, buying na textbooks, yeah, this zipline out. Police the belly pack can't seem be pound. A heifer, and this zipline supply textbooks. You support the argument with a video. You can't just come and make any just press conference, say anything that you like. Now, if I say we no more or more cano, and I TikTokers no, I bet class with problem in that candle.
Zipline. As for zipline, even in my debate yesterday, I indicated clearly that I am against the zipline contract. I am against the zipline contract. You cannot spend 170 million Ghana cedis that you are sending blood to health facilities using drones. The Ministry of Health should have bought their own drones by now. You can't continue spending that kind of money that you are paying a service provider. It's a total waste of money. The Ministry of Health should have bought their own drones. After all these years, the zipline contract, I recall, was signed somewhere in 2021. Can you imagine every year if we are spending 170 million Ghana cedis? 170 million Ghana cedis, so that they will go and drop blood in some village and then come back. Meanwhile, there's road network leading to almost every town, every community in this country. There are only few locations that you will say the roads are not accessible. That money could have tarred the roads to all those locations that we are concerned about. And Ghana Health Service could have bought their own drones. And that...
All right, Abusia. Dabia na ya na me ka kire wo no. Ensem bi say mete na se me hu se obi ba won chan say to abama NDC. Woni say ni pani nyina mo ye demons. moye political wizards a mo pese o man be konanim or the Sinibo as a majority leader say he is against zipline drone delivery and he is against it. He is against it. Adanya yentimi for 172 million Ghana cedis a year and zipline delivery e okurum ha. Na 172 million Ghana cedis a year no. E betimi atale all the roads in Ghana. Shasrowe. Mahama na mo so no. Enema ba form or ye niema yie no. Wejimi a akabo hu so onim nyansa. Ya sanitary pad ye ton no market 15 cedis. Omo be ka kire say ya sanitary pad that was sold in 25 at 25 Ghana cedis in January is now sold at 15 Ghana cedis. Na che say omo bo omo ho abaso fi say na yas boarding sisi yas so ate. Che say de omate yas company no tax omo gi free omo so. Yemfa nto yemfa ne sa aiswate e ya aban na ama swate ya gi atum. Now aban ni say what the 292 million dollars ekwakra sanitary pad ade abre Ghana for nkola. Say yemfa 292 million Ghana cedis enkwakra dollars 292 million dollars enkwakra pad mfamre Ghana nkola. Name zipline 172 million Ghana cedis. You know, he is against it, and it can that amount can tell all the roads to those health facility or centers. So now the question is, are there now no support on part? No, Osaka will be said the health ministry is supposed to finance or do their own delivery as drones, to buy their own drones. No money or money. And this, I don't know how my Ghana phone to part. Where I am simple, I must say this majority leader. And then how my Ghana for enter part. Now, oh my Ghana for to part. 292 million Ghana cedis now got an apartment. Yeah. Say, young from got to part. And from the room, who say the mamma. And then ye won't come or move for 292 million and ye Ghana when you talent ko bebia ayin wono ye nyina ye support the panting ka de wo kan wo se zipline hu hia pad ya Mahama de ba hu hia na I don't blame him too much. Oh, the way I will see different the abino. Oh, the way nothing wrong with $292 million the kwakra pad. Enti Mahama pad ba ko de betuma toyas miensa. Eti mo Jimmy anase dambo. Jimmy anase dambo. Mo yawahan mu say ana mo say your friend is a national cathedral. Mudin card 85 million buy. And so ana mo say 97 million buy. Say adan e koforo de akwakotu ho hu demonstration mani pa bebre gina so to abali tie aban no ya je atum mo aban ba ye na mo koye mo audit mo ye mo audit na kire say obi andi sika every money on the your friend is a national cathedral has been accounted for. And also national cathedral no manhu budget ekura ye no okrom hanum si ye de national cathedral shame as budget ye ti sika bi de akọ national cathedral ho. But where the taxpayers money and national cathedral based on mumu figures 85 bako 97 bako yajetum. Now 292 million against 97 million. My brother, hey, nano kura sembe kura ni. Ma spend a disesi kana wia sesi kana 2025. Ana mo sa dia budget team because e hone boamo e se be wia na 2026. You see nothing wrong with this. You see nothing wrong with this. But drone delivery na me say ana me real human kurase for sebe. When I titim kuro nketuam. Because me I've been to a villager and shoto kura kanko kwesi adaka anya adwuma. I've been to a village and shoto akanko kwesi adaka anya adwuma. Don't a fly to school muma udru krom ho no ma ehun hia so bekwa gobu so obi oye MPP ni ana so oye ndisi. Just walk straight to the school and ask them say drone service no how many times na did draw eba krom han so make catch us every day. On make catch us every day. The BI when they are catch them no, me say MPP enye nyame, NDC enye nyame. But the moment how we compare the two, no, MPP is far ahead. MPP is far ahead of NDC because they lack ideas. They are just incompetent. Anna say idea be free honoma e baaya. They want to demolish it. Sana kwasi ampanyini ba akobeta na TV so say drone that thing they said it's supposed to carry blood but it carries condom. Unim nyansa nka obonsu wajimi. Sisi Ghana hanu say wana enya ace got the increase aba in ace no say condom no say wase ye no ayi month bia de boss okra wetu obi fi Ghana ha cross nke just to reduce the number of ace incidents occurring or minimum. Condom no cry na wo kan cry na far better than pad na moto no. Bet me wrong. Condom na wo say drone delivery no deliver no. Far better than pad na mo de $292 million ekoto. What you say? These are some of the issues I transnational here dwene ho as. Ana ding say ebimus say or support when this moment na ya ban obebo. Like how? Look at all these people. They're in parliament. So Mukoye Bibi Papa Magana. Look at him. He is a parliamentarian. A majority leader as such. Such a shameful human being. How can you tell us this story? How can you tell us this story? Now you can say Asem to mommy, Asem to papa, Asem to unwea this critical condition I deal with it must save the life. Asem to neda. E tu be jina ho no my I say NDC amana be bo ma. We yo me say NDC ababa mon kire me one omo so omo ye de ande omo aye resetting. Omo ye resetting mon kire made ba akọ eye NDC ne ba ya omo ankasa hu sade we ye de ba ye nti ye resetting. Mon kire me one discussion in parliament aye discussing in parliament aye NDC initiative ne discussing in parliament. Mon kire made ba akọ aye discuss on radio so aye NDC initiative aye discuss on radio so are you people dumb or something? It's more adwena ye de dwena ankasa asema bi. Hey, Debbie, oh my God, I did akwa say ultima tenambisa because a Jimmy for the doors too much. A Jimmy for or tiny abro eba umu what the ni brenya hoya na ye bibi or tiny abro e wo mo the ni brenya hoya na ye bibi. Debbie have been saying it's a 2024 election. The factors that led to the loss of MPP bebre but ultimately or tiny abro ni bre ahoya tribalism free mu da. Because ni pano okoto aba no over 30 years kura won si ni krom baby o ten wo hu development wo honom pa but na adwene mu no hu ni say as far as one no we belong to a place ne de they owe a share in the party ne de also okoto na aba not because of say aban na nyehwe exactly that is what happened. Nanka we munti metna parliament keka say we mfa kire Ghana for Ghanaians are not angry enough. Ghanaians are not angry enough. And you should way most of them parliament say, or more shamrama, yen say, and you will be baby boy.
Chilawajo mame, ewo conversation. I Penyah Block Media. Accra.